This video will explain how we put the heart into the pericardium and the pericardial box. The tools necessary to do this include tubing. We have 3/8 tubing, which is the larger tubing, and 1/4-inch tubing, which is the smaller tubing. We have sections of 1/4-inch tubing that will be necessary to connect the balloons and to place the vent catheter into the pericardial box. This is a weighted tip that goes into the pericardial drain. I'll show you how to put that in. And we need 1/4-inch straight and 1/4-inch elbow connectors to connect the balloons to the pericardial box. This is a device that helps to lead the tubes through the pericardium. This is a tubing cutter, which you will need. This is the tubing release tool. This is a 4-sided knife that I will show you how we use that to make a hole in the pericardium. You'll need a pair of scissors, and this is a rack that we will use to put the tubes into the pericardium. As far as vocabulary is concerned, or glossary, this is what's called the pericardium. It will come to you with 2 holes in it, one in the bottom, which will be the drain for excess fluid from the pericardium, and then a second hole at the top here, which is the center point of the positioning of the heart. That's where the aorta will go. This is called the pericardial platform. It's where the pericardium is connected to the device. This is the bulkhead of the pericardium, and this is the pericardial box itself. As we prepare to put the heart into the pericardial box, we'll place the initial drain in the pericardium. The weighted sucker tip goes in the drain, and then the drain goes into what's called a push to connect connector in the bottom of the pericardial box. You'll note that the pericardial box is slanted downward so that any fluid that drops into the pericardial box will pool and will be picked up by the drain once it's hooked to the base unit. As far as the pericardial box is concerned, there's a slot here and a slot here through which a belt can be passed around the operating table in order to secure the pericardial box in position. The pericardial box has a bulkhead, and this bulkhead has connectors. This is a 3/8-inch connector. It is screwed into the larger receptacle. There are 3 of these that you will need to put into the system. These can be removed from the system, which enables you to clean them. There are 3 connectors that are 1/4-inch connectors. There's one for the left ventricular balloon, one for the right ventricular balloon, and a third. The third is connected to the pericardial box at its base for the connection to the drain. This connector is one that will become obstructed from time to time. Once you've screwed these connectors in, the next step is to put the pericardium onto the pericardial platform. Once this device is positioned, the pericardium itself is brought into place and placed in the rack. There are knobs on the ends, or on the underside of the pericardium, which go into the holes that are in the pericardial box progressively, and you position them as you push them down into place. They will lock into place once they are deeply positioned into the pericardial platform. It takes a minute or two to position all of these plugs into place, and once you've positioned them from the top, I'll show you how to go underneath them and be sure that they are adequately positioned. Once that's done, you can turn the pericardial box over and you can see where you need to continue to work with the pericardium to get it properly positioned in the pericardial platform. The pericardium is reusable for 5 or 6 different uses, and then it will need to be replaced. There's a flange on the underside of these knobs that needs to be secured in each of the pericardial holes, the large ones, in order to connect the pericardium to the pericardial platform adequately. Once you've positioned it, it can be then placed in the rack in order to position the pericardium to have the heart placed in it. These are the connectors that connect ultimately to the connections to the base unit. They are pushed to connect. They go onto and lock in place. When you remove them, each side of the drain or each side of the tubing will not leak because of the way these connectors are manufactured. The heart will come to you in a cassette. It's vacuum sealed. It has an ethanol-based preservative in it. You open the bag, remove the inner bag, which has the heart in it, and then take the heart out. When the heart's removed, we recommend that you rinse it with water. What you find is the heart has a variety of tubes that have been pre-inserted into the different blood vessels that are going to be a part of this project. These tubes will be cut by us when they come to you. These tubes, I'm going to show you how to cut them. The tubes that go to the balloons inside the ventricles you can tell those by the balloon sticking out. They can be cut relatively short. They are 1/4 inch tubes. This is the left ventricular tube here. I've initially cut the right ventricular tube. The tubes that feed the KV are going to be about 5 centimeters in length. They will be pre-cut when you get them. They will need to be trimmed. This is the aortic tube. Again, it's going to be pre-cut to about 5 centimeters. And the pulmonary artery tube, I will cut to about 5 centimeters. At this point, the heart can be positioned and oriented. Sometimes it's a little difficult to orient the heart, but ultimately you'll figure out exactly how it's oriented. The left ventricular tube, the right ventricular tube, the aortic tube, the pulmonary artery tube, the superior vena cava tube, and the inferior vena cava tube are here. Once you've oriented the heart, the next step is to place it in the pericardium. Once the heart is positioned in the pericardium, then we're going to sequentially place these tubes through the pericardium. The first tube through is the aortic tube. This is a leader for the aortic cannula to go through the pericardium. It's placed in the hole that's been pre-cut, and then the tube positioned behind it, and the entire thing pushed through the tube. The leader helps to position the aortic tube through the pericardium. Once it's in position, the entire aorta will go through the hole. The leader will drop out, and you can pick it up from underneath. Now, at this point, the heart is positioned, if you will, within the pericardium in an appropriate position. Now, that position of the aorta is going to dictate the position of the remaining cannulas, and that's the reason for that aortic hole being there, and we've not made additional holes. This is a knife that has 4 sides to it. It's going to be used to make holes in the pericardium at the proper position for the cavity and the pulmonary artery, as well as the ventricular balloons, dependent upon the position of the aortic cannula. Once you position the heart, the next cannula that we believe is appropriate to place is the superior caval cannula. And you can see that I am getting an estimate of where the superior caval cannula goes. I'm going to make an incision with the 4-sided knife, and when I pull the knife out, I will insert the leader cannula in, position the caval cannula over it, and then push the entire assembly through the pericardium. We're going to repeat this procedure for the other cannulas sequentially, and essentially it's exactly the same maneuver. The inferior caval cannula is next. One determines where it should go, makes a hole in the pericardium, follows that hole with the cone-shaped leader. The pericardium is of variable thickness in the way that it's manufactured, so you have to be careful to find the correct hole, and then you push the inferior caval cannula through. Progressively, the heart is positioned within the pericardium as we add these cannulas to the preparation. The next cannula is the pulmonary artery cannula. Done in a similar fashion, you have a sense of where it is, position the 4-sided knife through, follow it with the leader, and then drop the cannula through. At this point, the balloon cannulas are next to be positioned. The balloon cannula that's a little bit difficult to position is the left atrial balloon cannula, and you can look inside the pericardium, see the best place for it, make the 4-sided knife hole, follow that with the leader cannula, and then the balloon cannula itself positioned on the leader cannula and passed through the pericardium itself. You can pass these balloons through the pericardium without the leader cannula, but it sure does make it a lot easier to position it. Now we're at the right ventricular balloon, and again, its position is chosen dependent upon how the cannula presents itself to the pericardium. Sometimes you have to make a second hole because this pericardium tends to try to close on itself. Once you have these cannulas completely through the pericardium, we're ready to connect the pericardium, connect the cannulas to the bulkhead of the pericardium. The way that you do that is that you pick the platform up, move the rack out of the way, and then position the pericardium in the heart with the face downward. At this point, the individual cannulas are secured to the pericardium and brought through. The cannulas, when they come through, the pulmonary artery cannula is cut off relatively short. It's not going to be connected to anything. It's going to drop the fluid into the pericardial box. At this point, the position of the aortic cannula is determined. It's going to be connected to the aortic cannula outlet, and you can see that it's too long. At this point, you make a judgment and recut this cannula, and then position it in the push to connect connector. You need to position it deep into the connector so that it will stay into the connector. This is the superior caval cannula, and at this point, this cannula looks like it's about the right length, so it gets positioned inside. The next catheters that are going to be connected are the balloon cannulas, and depending upon the angle of these cannulas, you may have to choose a straight connector or an angled connector to connect them to the sites. This one looks like it would be best served by a straight connector, so I'm going to put a 1/4-inch tube in there. I'm going to then cut that tube and use a straight connector to connect it to the balloon. This cannula, on the other hand, looks like it will be best served by an angled catheter. I'm going to connect the balloon, connect the tube directly here, and then estimate the position for this angled connector. These connectors are connected appropriately, and when we put them in the pericardial box, you'll see that they're properly positioned. The next cannula that needs to be connected is the inferior caval cannula, and it comes all the way around here in a loop fashion. The next step is to fashion the inferior caval cannula. This is the inferior caval tube that comes through the pericardium. It can be shortened, and then we're going to construct a U-shaped connector. This is a 3/8 elbow. The next step is to put a 3/8 elbow there, and then to choose an appropriate connector piece between these two. This piece actually can be used on subsequent uses. This tube is a little bit too long. I'll show you the way the release tool works. The release tool fits around the tube and then is pressed against the push to release. It pushes down the locking mechanism, and we can shorten this tube up a bit so that it will fit properly, and then push to connect. Once that's accomplished, you've hooked all the tubes up underneath the platform, and at this point we'll bring the pericardial box back and then position the heart, the pericardial platform, inside the box. At this point, the heart is ready to be connected to the base unit. Each of the tubes has been placed through the pericardium, and each of the different structures is in the proper position. One of the features of the pericardial box is the window in the side. You can look through and be sure that the tubes are in proper position. If there's a leak around one of the connections, you'll see it. and it can be corrected. At this point, the pericardial box is ready to be connected to the base unit and the heart animated.